Good morning. I'm New York City Controller Brad Lander, and I'm delighted to be here at Street Corner Resources together with New York City Public Advocate Jumaane Williams and a great array of folks from the city's crisis management system to release our new report, The Cure for Crisis, to deliver a clear and urgent message that communities have the power to address gun violence. This is something that folks in the room have known a long time because back in 2012, under the leadership of then City Council member, now Public Advocate Jumaane Williams, New York City established the crisis management system. The Public Advocate looked out around the country to say what's working in addressing the epidemic of gun violence. And what he found was that there are places around the country that were tapping into the power of community and mobilizing people in ways that actually address the epidemic. As a result, city resources have grown significantly to groups just like Street Corner Resources. And I want to thank you, Dr. Aisha Sekou, for your work leading it and bringing us these amazing young people and all this work, and for hosting us today. The programs equip trusted community members with resources to mediate conflicts, to prevent retaliation. We're going to hear about a program that focuses especially in the hospital after shootings to prevent retaliation, and to get at the root causes of violence through a public health approach. And today, the crisis management system that began as a result of the Public Advocate's advocacy now encompasses over 20 community-based violence interrupter organizations like Street Corner Resources. And we have several others here today. We've got folks from Guns Down, Life Up. Here, let's, kind of give it up for each of them.
Absolutely.
Operation Hood.
Yes.
Save Our Streets Bronx.
Yes.
And Rise. Thank you to all of you for being here, and especially to Street Corner and the young people who are here. So here's what we found in this report. And, it's things people have known who are in the community for a long time, but it's good to look at the data so that you can actually have evidence that the outcomes are working. And this is what we found. We looked at 19 years of shooting data in the neighborhoods that have a CMS program, a program in the crisis management system, and compared them to neighborhoods that are comparable in other ways, but don't have a program like this. And what we found is a 21% better drop in shootings, 21% less gun violence when you have a CBI program. So that says, the data says this work works. And what does that mean? That means fewer shootings. That means fewer people getting killed. That means fewer people in the hospital. That means a 21% greater reduction in gun violence, in lives lost, in people harmed, in peace and safety in neighborhoods. And that is not a coincidence. That is a direct result of the hard work that people like the groups in the room are doing, and a direct result of the resources that the Public Advocate and others have been fighting so hard to make sure flow into neighborhoods so we achieve public safety with communities. So at the same time, we did find in doing a lot of interviews and research and work with the groups that there are some significant ways the program can be even more effective, because money has increased to these groups, but there are a number of problems we found and ways things could be better. So one is that City Hall's got to do more effective management and coordination across the groups, provide more clear data and reporting. I'll give you one example. These contracts used to go through the Mayor's Office of Criminal Justice.
That's right.
And then they got transferred to the Department of Youth and Community Development. Some of the contracts have been transferred multiple times, and each time the outcomes reporting changes. What data you're supposed to give to the city changes, how you interact with the other CMS groups, how you interact with other public safety systems, and how that data is then provided to the community so people can understand where violence is going down, what needs to be addressed specifically, which programs are having the most impact. All of that could be much more effective. But unfortunately, Mayor's Office of Criminal Justice has seen a lot of changes under this administration, and there just is not clear management and coordination across the crisis management system. So we're calling for a real-time CV. First, just steady outcomes and reporting requirements. So everybody knows what they have to report. It's the same across all the CMS groups. We keep it steady over time. And then provide a real dashboard. People like being able to see. Part of what people like about CompStat and Neighborhood Stat is an ability to see how safe is my neighborhood? Is it getting better? What areas are more or less safe? Which incidents are going up and are going down? We have that with CompStat and Neighborhood Stat. Those can get better too. But we want that for CMS as well, so that the good groups these organizations are doing are visible to the public. And people really see, when people trust what's going on. A lot of these programs are about building trust in neighborhoods.
Right.
And that, of course, is done on the street corner.
That's
why
right.
it's called
That's
street
right.
corner resources.
Exactly.
But you also build trust through transparency and showing everyone what the numbers are. And we can build that trust better and make these organizations more effective with a real-time dashboard, by easier ways of sharing that data with communities, by integrating what you guys are doing with the city's neighborhood stat program, which really tracks quality of life and safety in neighborhoods and lets communities understand what's going on in their neighborhoods in clear ways that include the work you are doing and the safety that's being produced as a result. We're also calling for the city to expand crisis management system into high-risk areas without coverage, of which there still are quite a lot, in parts of Harlem, Inwood, Washington Heights, and Longwood, and to put more resources into neighborhoods like Brownsville, North Harlem, East Harlem, and the Central and South Bronx, where shootings remain frequent despite CMS investments. And then finally, and I know this one is near and dear especially to Dr. Sekou, and I guess to Penda, who's responsible for the payroll, because another thing that we found in this report is that these groups are waiting an obscene amount of time to get paid. The average wait time for reimbursements for the work you guys are doing, went from 130 days, which was already pretty long in 2016, to 255 days in 2024. That's a 96.5% increase. And imagine if we said to our police precincts, please start doing the work on January 1st, and sometime maybe next September, October, November, we'll start paying you. Would they? That would not work.
No, it wouldn't.
It doesn't work there, and it can't work here
That's right.
as well. So the city must fulfill its longstanding promise to launch what's called contract stat, so everyone would be held accountable for timely contracts registration and timely payment. The city charter establishes for our office a 30-day deadline. When we get a contract, we have 30 days to register it, and nothing motivates you like a deadline. My team has been registering those contracts on an average of 17 days, but nobody else in the system has a mandated deadline or timeline. So we need to provide, as Dr. Sekou was saying earlier, upfront payment advances at the beginning, so that in that January month you've got some resources that you present invoices for, and then fix this system and get our crisis management groups paid on time. To end with, this report is a call to action for the city to prioritize and to properly resource these organizations, which have already proven their value, but can do so much more to keep our communities safe. We estimate that there have been, as a result of these groups, 1,000.
She wasn't feeling good.
Can we get some water?
Can we stop?
Take a minute. Oh, it's Ramadan and she's fasting. All right, stand in while you're fasting.
Laura Jean, would you want to see if we could take her next door? Is she able to stand? No.
Yeah, that's standing and fasting.
Yeah.
For
And
some
then
it's
have the
different.
controller go on too long.
properly at the time that they supposed to.
Right, they didn't have that so.
Thank you, guys.
All right,
I hope
yeah,
that this is
thank
not
you.
something that ends
No.
up on the news.
No,
Fasting
that'd be
is
okay.
private and
That'd
things
be
happen
okay.
when you
Yes,
fast.
yes. The reporters are good folks here. They're
They
not.
are.
They're not. So, all right. All right. So, just want to make this one final point because it really puts the number out there. We estimate that as a result of the work of our crisis management groups, we have seen 1,567 fewer shootings as a result of the work that these groups are doing, and that is really a remarkable achievement. But that's just the beginning. We could be doing even more, and so we're here today not just to celebrate that work, but to build on it and improve it. And it is now my pleasure to introduce the person who, as I say, was really the first person inside City Hall to say, what are we going to do about the epidemic of gun violence, who did nationwide research to figure out what was going on and became the leading champion for bringing resources to groups just like Street Corner Resources and the others who are here today. And that is my partner in safety, public advocate Jumani Williams.
Yes.
Thank you, Comptroller. Peace and blessing, love and light to everyone. Thank you, Street Corner,
Thank
for having
you.
us, and
Thank you for being.
all the folks who are here. I got to shout out my brother from another, K. Bain, CCD. Without him, I wouldn't have had the understanding. He comes from the world a little more than I did. He used to be part of the issues going on, and then switched around his life. And he's the one that helped me understand this would really be as impactful as I was hearing. So I want to make sure I give him a shout out as well. You go back, growing up, there was a lot of law enforcement in communities that were black and brown and were told it was to try to address the violence. Except I kept seeing the violence continue. And then you go to about 2012, when we had an abuse of stop, question, and frisk. Again, with folks who were here, including my partner in safety, we tried to figure out how to address those abuses, and we were told that if we did that, the sky would crack open, young people would fall from it, and they would destroy the whole city. We said, no, that's not true. You don't have to abuse the community to keep them safe. And at the same time we were doing that, we started hearing from communities that were doing this sort of work. And I was proud to co-chair the task force to combat gun violence that helped bring these resources in. We got these resources in, and we went on almost a 10-year decline in shootings and murders. The city got safer. And it's important to point out, and I'm thankful for this report, because many times people push back on the work we're doing, saying somehow we don't want our communities to be safe. We want to coddle criminals. You're just anti-law enforcement. And we're saying none of these things are true. We're just saying trying to arrest the children of the people you arrested 20 years ago is probably not going to have a different effect than it did 20 years ago.
That's right.
And people are still dying. And what frustrates me is no matter the evidence that we show, we still can't get the support that's needed. We have said this has worked. We've shown data that it's worked. We're showing data again that it's worked. The primary thing that stopped is the pandemic. That stopped some of the work that was going on. And we saw an increase in violence across the nation. And immediately a knee-jerk reaction again, let's just send law enforcement and incarceration. Handcuffs, batons. And we're saying Law enforcement has a role to play, but everybody at this point, everybody in every community knows they cannot do it themselves. And when we ask them to do it themselves, it's unfair to them. It's definitely unfair to the community. And the community has been pleading and begging for the resources that they need to help solve this problem. 1,567 fewer shootings, 21% reduction in violence and shootings in the communities that have this. So this looks at places that have it and places that don't. Even as it's going down, it goes down even more in communities that have it. What about $100 million? $100 million for the entire system. The police department is $6 billion. If you count the money they get outside of the city budget, it's $11 billion with a B. And what's happening is that we're trying our best to make sure overtime is what it should be in the police department, and these guys can't get paid. That makes no sense.
No sense.
Why can't we get the investments that work? This says it works. We're not trying to avoid the violence. We're not trying to pretend that it's not there. We're trying to do everything we humanly can to stop it. And we know that requires resources and money. That's why the police department is at $11 billion. But yet, every time we push this, there's pushback. As if we're not trying to do something that's real, that saves lives, and also doesn't harm the communities. Any community I go into, anyone, Republican, Democrat, I ask, do you think crime is an issue? Raise your hands. Do you think law enforcement is a partner in trying to deal with that? Raise your hands. Do you think they can do it themselves? Everybody says yes, yes, no. That third question is where we get so much of the pushback. And everybody knows they can't do it themselves. Well, what does that mean? It is communities, it is organizations, it is structures like this that fill the gap, but they can't get funded properly. When they do, they can't get their money. They're not respected in the public safety spaces by government. I don't remember the last time I saw them at a press conference when they were talking about the data of the shootings in the city. Why can't they get the respect that they deserve? It makes no sense. You want data? You got data. More than enough of data. Let's get the funding in and let's structuralize this.
That's right.
That's
That's
it.
right.
And I'm the first to say, because of some of the things that have happened, some of this work has stagnated. We want to build on that. There's other programs that can be put on top of this infrastructure that's there. It is here. It is there. And believe me, law enforcement doesn't want to be asked to do everything. So we're pleading with for folks. If you want data, look at the data. If there's issues going on, let's fix the issues. If it's something that we need to change, let's change it. But you can't ignore what's happening and the impact that it's had. What if they had $6 billion? Can you imagine? What if the community had $6 billion? That's a whole nother press conference. It's a whole nother press conference. But there is money and resources out there for communities that look like the ones that we work in if you want to invest in them. That's the bottom line of this. And that's all this is about, fixing whatever problems are there, structuralizing this, putting resources on it, and building on it. And all we're asking is to do that for something that actually works. We can back it up with data and doesn't harm the community.
That's right.
What else can you ask for? And you asked about victims. Victims are asking for these as well.
That's right.
And their family members. So stop abusing the trauma of victims to further traumatize communities.
That's right.
Provide the things that they're asking for and have been pleading for many, many decades. We can do that. So thank you, Comptroller. Thank you,
Thank you.
Doctor. Thank you, everybody who's here. Let's get it done. It's
Let's
beyond
get it done.
simple at this point.
Let's
Thank
get
you.
it done.
I want to build briefly on one point the public advocate made about the role of victims, because one of the things, I was just talking to Maria from Guns Down, Life Up about this, one element of these programs that's been increased in recent years is to focus in hospitals where there's been a shooting, to actually go respond, to meet a victim, to
That's
provide the resources and support that they need, and then talk about how to prevent that from rippling further into the neighborhood. It's precisely by doing that kind of response to victims that you build peace and prevent retaliation. And
Absolutely.
that's exactly the kind of work that's being talked about here. Now you're going to hear from a couple of people that do that work. And the first is our host, the leader of Street Corner Resources, Dr. Aisha Sekou.
Peace and blessings, family. I'm Dr. Aisha Sekou, the CEO and founder of Street Corner Resources. I'm truly proud to be in discussion about this issue of gun violence. I want to thank our public advocate, Jumani Williams, and of course, our comptroller, Brad Landers, for having this press conference to talk about this issue. So one of the things when I think about gun violence and I think about a remedy to gun violence, I think about we cannot put a Band-Aid on a gushing wound. We cannot put a Band-Aid on a gushing wound. Our children are dying in the street. It's no more that they're just getting shot or stabbed, they are dying. Many nights, the Street Corner Resources, Speak Peace Forward team, and others around the city that are doing this work sit with young people who are losing life. It is preventable. There are things that we can do. There are things we are doing, but it is not enough. More funding needs to be accessed, and that funding needs to be accessed in a timely manner. Do not ask us to go out and stand in front of almost the gun and those who are caught up in the violence, and then we can't get a paycheck or get the money to pay our staff. That's workers have been shot in this work. Street Corner Resources also has a contract in Harlem Hospital where we have more than 100% response. That means that we've been operating on a 24/7 basis. But we can't do that without funding. And so I'm grateful to have had voice with this, the Cure for Crisis. I'm really appreciative to have had those discussions that added to this, this document, this paper, this executive summary. But we need the action that comes from this paper. We need to know that when we get our funding, we don't have to wait 8 months in order to have money to pay our staff, that happens in a timely manner. And then we're also looking forward to having more opportunity for the young people in our communities so they don't have time to get caught up in violent behavior. Violence has become recreational. It has become recreational, like a video game, but live. The thing is the child doesn't return from the dead, nor do they get out of the prison immediately. They have 25 years off of their life behind bars. But we can change that. We have an opportunity to change. We're proud that this morning we had young people out planting flowers in front of our space. I know it sounds corny, but when they plant life, they understand life because they see that grow. And they also have possibility because they know that they can grow from any place and go to college and become interns in their community and then fill those political positions that they work in those offices. And they see possibility. And we do that here at Street Corner Resources, but we need the money. We need the money on time so that we can do more of what we do and save lives. Peace and blessings. I'm Dr. Aisha Sekou, CEO and founder of Street Corner Resources.
Thank you so much, Dr. Sekou. You talked about the folks who, we've been thanking the folks who are doing the work out in the communities. I do want to thank the folks who did the work in my office on this research. So we're going to say thank you. The principal researcher on this report is Justin Richardson, who's senior policy researcher for criminal justice and public safety. And public advocate. Before he worked in our office, he worked in the office of the NYPD Inspector General. So that also came out of that work that we did together. And we've got Khalil Sulker, our strategic organizer for community safety and restorative justice. And as Dr. Sekou said, in addition to digging in and analyzing the data, we did a lot of outreach to the CMS groups to get their perspective and develop that into the report. But we also did a deep data dive, and that was done by Dan Levine, Senior Data Analyst and Products Manager, who's here, and Robert Callahan, our Director of Policy Analysis. So thanks to all you guys for the work on this excellent report. And to close us out, We will hear from one more of the CMS groups. It's my pleasure to invite Derek Scott from Operation Hood.
Yes.
All right. Well, good morning. Good morning. Good morning. Good morning.
Great morning.
Good morning. My name is Derek Lateef Scott, Operation Hood, founder, director, project of JCC GCI, Jewish Community Council of Greater Coney Island. I'm just going to piggyback what Aisha said, what Brad said, and also what my brother here had mentioned. In terms of the work that's being done. In Coney Island, we've had numerous of days, 200 days without a shooting. The last one, 292 days without a shooting. This was last year, 292 days without a shooting. And the communities are getting it. The communities are getting it. And I'm going to tell you, the last shootings that we had, these were drive-bys from another area, not from Coney Island itself. So when we talk about needing funding, we need the funding so that other CMS sites can actually get that, so we can connect the dots and try to match this here and try to make things work within our areas. If you're coming from Flatbush to Coney Island, let's talk to Echo, who's in who's in Flatbush. Let's talk to other CMS sites that's in Flatbush, so that we can actually make this thing work. We have to make this work. We have to connect the thing. Who says that Coney Island doesn't come uptown? So if we can connect the dots and make things work in that perspective, I'm talking to you, you talking to me, we are all talking to each other. That is combining a structure.
That's right.
Where we can actually make things work. The cops do it all the time, and not to say that we're cops. We're not. We're just proactive. We're just proactive. But we need to form Voltron, as you mentioned. We need to form Voltron. When there's certain things going on, we have to connect. I have to call Aisha. Aisha have to call AT. AT has to call Erica Ford. We have to make this thing work like Voltron. And without the funding, it's not going to be possible. It's not going to be possible. So I ask those that are in attendance, I ask those that are behind this wheel, listen, imagine if we all cared. And that's my quote. Imagine if we all cared. Thank you.
Thank you, Derek.
All right.
Thank you. Thank you.
All right, and then as I mentioned before, we're also joined by Guns Down, Life Up. Let's give it up for them. We're joined by #1 draft pick. Let's say thank you to them. And then just one more time, we want to say thank you to all the groups that have produced this 21% greater reduction in violence, over 1,500 shootings prevented, many lives saved through the hard work of the folks up here and the other groups throughout this system. Let's reward that by making the system work better so we could save more lives and promote more